For our grand finale, we have Dr. Michael Paré. He's a general physician and a psychotherapist. He treats all kinds of conditions that I suffer from post-call, including depression, anxiety, host of other emotional issues. Dr. Paré's approach is supportive. He holds a diploma in psychoanalytic therapy. He's certified in interpersonal and group therapy. Dr. Paré is a teaching mentor at both the General Practice Psychotherapy Association and the Collaborative Mental Health Care Network of Ontario College of Family Physicians. So I'll be coming to see you at some point.
I called it.
No way, I'm there first. In all seriousness, though, Dr. Paré has participated in Mental Health Illness Awareness Week and is a face of mental illness in 2006. This was an initiative partly organized by the Ontario Psychiatric Association to promote awareness of mental illness amongst the public and to decrease the associated stigma. Dr. Paré's story is a drastic descent into depression that highlights physicians are not immune to mental illness. Fortunately, with proper treatment and ongoing care, Dr. Paré has made a full recovery. And research has shown that individuals who live through experience of mental illness are those and who can speak about it openly are those who can raise more needed awareness about the issue and decrease the stigma. So thank you for joining us today. Please join me in welcoming Dr. Michael Paré.
Well, thank you. Thank you very much. Today I want to talk to you about my own serious depressive disorder and illness that is not something I'm proud of talking about. To get up here and talk about how sick or even mental or crazy I was is not easy at all. But the evidence from research shows that it can help decrease stigma. Today I'll be discussing emotional problems. I care about the people, including my patients, my colleagues, and myself who suffer from these conditions. Nevertheless, I reserve the right to gently joke about this topic. You can laugh even though it's sort of horrendous. Of course, I mean no disrespect by this. You might be triggered by my talk, and so you can speak to somebody, including myself. I will talk about both my subjective emotional experience and the objective reality of depression. I am somewhat, unfortunately, uniquely able to talk about both, and I will do so using my artwork as a way to convey the sheer strangeness and horrible reality of this disorder. In the year 2006, I was a so-called Face of Mental Illness Awareness Week, a national anti-stigma campaign. I volunteered to do this to fight against the stigma of mental illness. Now I asked them, could I be a face of mental health? And they said, no, it has to be mental illness. The stigma is especially strong, paradoxically, in certain fields such as medicine and psychology. A report by the Surgeon General of the United States in association with the National Institute of Mental Health says this about stigma. Powerful and pervasive stigma prevents people from acknowledging their own mental health problems, much less disclosing them to others. For our nation, and I would say Canada as well, of course, to reduce the burden of mental illness, to improve access to care, and to achieve urgently needed knowledge about the brain, the mind, and behavior, stigma must be no longer tolerated. Actually, we backed off that. We're not going to get rid of stigma. We need to try to control it. So I was a poster boy for mental illness. The posters looked a little like this. This is what they said about me. Michael has suffered from severe depression and was seriously suicidal. But with the help of his physicians and the right treatment, and with the support of his family and friends, he has built a successful career and lives a full, rewarding, and balanced life. Well, maybe not so balanced, I'm a bit of a workaholic, but balanced enough. It is very difficult to know how to even describe how depression really feels. So I'll try to get some assistance from Franz Kafka, Salvador Dali, and John Lennon. This is a poster I had hanging on my bedroom wall when I got depressed. It is definitely a great work of art by Salvador Dali. Yet I now find it rather hideous. At that time, I really liked it. I suppose it reflected my emotional state at that time, which was horribly depressed. But it was not the posters on my wall alone that reflected my state of mind. It was also the art I actually produced myself. This is one of the images I created, it's a self-portrait. I like what John Lennon sings on his album Imagine. You can wear a collar and a tie. One thing you can't hide is when you're crippled inside. This is another self-portrait. You don't need to be a psych resident to perceive a little disturbance in the artist's self-image. This is my image that shows a mental state that at the time was very disturbed, as you can see here. I was exceedingly intent on completing an irrational attempt to improve my life by taking my life by suicide. I ended up in a coma. They say that suicide is a permanent solution to a temporary problem. Sometimes people think it is warranted and or wise to kill themselves. Why would that be? People considering suicide perceive their dilemma as inescapable and often feel an utter loss of control. Now, I'm not going to read all this. I'm going to let you read them. They can't make the sadness go away. And you can read some more of these things. They can't make decisions. And a lot of other things here. They can't sleep, eat, or work, and they can't get out of the depression. Franz Kafka, in his novel Metamorphosis, introduced us to Gregor, a man who becomes an insect. To communicate to you my emotional state, it is useful to rely on Kafka's depiction of an insect man. Poor Gregor had turned into a bug overnight, and he was lying in bed trying to get up to have breakfast, to go to work, but he couldn't get up because he's a bug. He's on his back, and his family is calling him for breakfast. He had slept late as well. I guess that's the least of his problems. But his family was calling him to get to work, a job he hated, and his family depended on him. He's going to let them down. It's hard to work when you're a bug, and now he is a bug. This is Gregor, but he's not a bug. Rather, he's suffering from a mental illness. It's a cognitive distortion. Well, sometimes I felt like I was an insect myself. You can see that I'm still, even though I'm alienated, I have some awareness of my appearance and concern. You notice I've matched my tie with my eye color. I suffered intense psychological pain. My depression got worse. I suffered every day, all day. But I did not seek help. Okay? I was just suffering, but I didn't seek help. But this is actually not uncommon, and it's fairly typical of medical students, residents, and physicians. When I see physicians in therapy, and I work with the PHP of the OMA, Physician Health Program, they're often much sicker than average patients, and this is well known in the field. We are too independent, we're too proud, we're too tough, at least on the surface. Also, the culture of medicine is against it, against getting help. It may be changing, the fact that you invited me here today. When I finally opened up and talked about my depression, I did get help from the Ontario Medical Association. Years later, when I shared my story with medical colleagues about my history of depression, they were very supportive. Most were very encouraging. Nevertheless, one colleague approached me and said, I hear you've switched sides. I said, what do you mean? He says, you used to be a physician, now you're a patient. That is such a black and white thing. Obviously, you can be both. The irony is, he works in my clinic, and I have 30 doctors, and he works in my clinic, and he's on stress leave now. My everyday life was like walking around in a Dali painting. Here I am up there. I'm down here in this one, and I'm up here in that one. Okay, I love Dali, but nobody wants to walk around in a Dali painting. As you can see, they're sort of nightmarish. Okay, this is me when I'm 22. Actually, it's not actually me. He looks like me though. He looks a lot like I did. Let's just pretend he's me. Notice that I have a pimple, actually. There's a pimple there. But because of my anxious state of mind, my pimple didn't become just a pimple, and it was huge pimples, massive pimples, and they were getting bigger and bigger. I was horrendously distorted in my perception. But it got worse than that. After a while, I didn't have pimples, I became a pimple. You know, and this is not good to be a pimple, to actually be a walking and talking pimple. So dating became a big problem. Okay, so it's hard to sit next to somebody and talk to them when you're a pimple because that's not fair for them or you. So depression felt like a burning in my brain. It was like my brain was on fire. It was constant, and I had what could metaphorically be called a suicidal brain. Eventually, the feeling of burning alive was completely consuming. I felt almost constant psychic torture day by day by day by day. And I was trained in psychology. Why didn't I call a doctor? Because of a lack of insight. There was hardly any relief. Then it was then that I decided to kill myself. After a huge amount of indecision, I finally decided life was simply not worth living. The constant pain was just too horrible to endure. I kept thinking of putting a bullet into my brain. That would end the pain. I kept checking to see if I would use the gun. I was convinced I would, yet I couldn't find a gun. If I lived in the United States, I'd be dead now. With a bullet through the head, I'd just go down and buy a 6-pack of beer and a gun. And no ID probably, or maybe just my driver's license. But here you can't do that. You just can't buy a gun in Canada easily. But I was okay in terms of my friends and family. Around them, I was able to fake some sort of passing performance of mental health. Nevertheless, internally, I was hopeless, lost, and filled with self-loathing. So, since I had no gun, my next plan was to jump from my apartment building. I got out on the ledge about 14 stories up. Now that's a creepy and scary place to be. This is what it looks like at that high up. Nevertheless, I lost my nerve. I was afraid of the splat. I didn't want to splat. I just didn't want to splat. As far as I could tell, I was not afraid of killing myself at that point. I was just afraid of the fall and the splat. Also, I didn't want to change my mind halfway down. And these are the kinds of things you think about when you actually think about doing it. But I bought myself a lethal dose of pills, and my mood improved tremendously, as the literature often shows. When somebody's close to suicide, they may get better in terms of their overall mood. The pain will finally be over. I made a serious suicide attempt. I took 80 pills of a muscle relaxant. I was found comatose. I was rushed to hospital. It wasn't clear what the problem was, yet it was clearly an emergency, It was clearly an emergency. They rushed me in. A lumbar puncture was negative. They pumped my stomach, and I was admitted to hospital in a coma. Yet I was quickly helped by Emerge and psychiatry, and I was given some psychotherapy and medication. Indeed, if it wasn't for the emergency department team and the psychiatry team, I would be dead now. I was allowed to return to school less than 1 week after I woke from the coma. I had to go back to the hospital. So I was going to classes, coming back to the hospital. I can't remember how long that lasted, but I thank that clinician for allowing me to do that, so I didn't lose a year. Long-term psychodynamic psychotherapy on the couch, like the Freudian stuff, helped tremendously. So Lenin was wrong. You can wear a collar and a tie. One thing you can often hide is when you're crippled inside, especially physicians. were amazingly good. And the stories are that they're very, very good physicians right until the next day they commit suicide. And it's not an uncommon story. I quickly entered individual and group therapy. I was allowed to return. I said that 1 week after my coma. I was in psychiatric day treatment, and long-term psychodynamic therapy helped me tremendously. So today I'm mostly focusing this talk obviously on my personal story. On the one hand, physician health and its converse, physician depression, burnout, and suicide are issues we must all deal with. We need to share our insights and experiences in developing educational programs designed to create a community of care for physicians experiencing emotional distress. And we are, to some extent. The OMA, PHP, and across the country, there's a number of physician health programs that are doing amazing work in this. And I would suggest that you call them. That's where I called, and I got help from them. In medical culture, we deal with distinctive factors, social, psychological, and cultural, in physicians' lives that contribute to their being highly competent, functional, and helpful professionals. And also, in other times, these factors may contribute to their being depressed, burnt out, and even suicidal. Although physicians are taught that they are superhuman beings, in actual reality, physicians are, of course, simply human. Or as Harry Stack Sullivan, a renowned psychiatrist, said, all of us are much more human than otherwise. And doctors are at least as vulnerable to mood disorders and suicide as are other people. Therefore, it is essential that we as physicians must become more skilled at the recognition, assessment, and treatment of these very serious emotional illnesses in ourselves and our colleagues. But we shouldn't treat ourselves, we should recognize it and refer ourselves to a physician. My conclusion on the next slide, I will say some things to be aware of as danger signs. Now, this talk was not a practical talk, except for the fact that if you get depressed or a colleague gets depressed, get help from a physician. I was mostly telling my story. The brain has much to do with depression and suicide, but today we have only talked about the suicidal brain in a metaphorical sense. But to wrap up, depression and suicide in medical students and doctors has a number of factors that may be warning signs. Perfectionism. You know, I mean, some doctors are going to say, I don't have that problem, I am perfect. We are placed, and we place ourselves detail, of course, and of course being accused of medical malpractice massively increases stress. So I'm just going to wrap up now. Thank you for allowing me to tell my story. Yet this is not just about me, this is about you. It's potentially about you. Some of you will suffer depression. Please seek out help you might need. Very seriously consider calling the Ontario Medical Association Physician Health Service or the equivalent in the province you come from. Thank you.